Introducing the Shikani speaking valve, a revolutionary new product giving tracheostomy patients the power of speech. The Shikani speaking valve was designed specifically to improve the quality of life for tracheotomy patients, allowing them to speak and breathe with ease.
The Shikani speaking valve changed my life dramatically. I work in a hospital with a lot of different people, and when I used the other speaking valve, it was very tiring.
Due to the flexibility of the Shikani speaking valve, many patients who have never tolerated a speaking valve before can use the Shikani speaking valve. With this innovative valve design, the patient has complete control over how airflow is directed into the upper airway. Depending on how the valve is positioned, it can either function as a bias open valve or a bias closed valve. When placed in the 12 o'clock position, the valve functions as a bias open valve. In this position, the patient breathes through the tracheostomy tube as if they are not wearing a valve until they go to speak. When they speak, the normal exhalation forces that we all use seal the valve and redirect the air into the upper airway. When used in the 6 o'clock position, the Shikani speaking valve functions as a bias closed valve. In this position, every breath is redirected into the upper airway. In many cases, patients initially use the valve in the bias open position and eventually transition to the bias closed position as their respiratory status improves and they feel more comfortable wearing a speaking valve. The unique design of the Shikani speaking valve also allows for use with the Shikani HME. An HME functions as an artificial nose, allowing for normalized temperature, normalized humidity, and particle filtration, all of which improve pulmonary health. Never before could a patient receive the benefits of both an HME and a speaking valve in unison. Because of the Shikani speaking valve's adaptable design, patients are now able to receive the benefits of both speech and increased pulmonary health.
I can breathe, I can talk. I feel good.
For more information about the Shikani speaking valve or the Shikani HME, visit theairwaycompany.com.